Today we're going to be demonstrating how to do urine collection via cystocentesis. Before we start, I want to make sure that we're prepared and we have also the supplies that we need. We have our lab requisition form. We should also have our patient record, have our sterile needle and syringe, our sterile red top tube to put the sample in, a second needle for sample transfer, and a bottle of alcohol. First thing I'm going to do is I'm going to have my patient in dorsal recumbency. I'm going to gently palpate the abdomen, feeling for the bladder. I'm feeling for a little blip so I can feel the bladder sliding between my fingers. Once I am confident that I have the bladder in place, I'm going to gently grasp it, spray with alcohol. I'm going to get my needle and syringe. Now, I have a 23 gauge needle and a 5 ml syringe. I'm going to have my bevel up, and I'm going to go at a 45-degree angle. I'm going to always point the needle caudally towards the trigone of the bladder. We want to point the needle towards the trigone of the bladder because you want to ensure that the needle stays within the lumen of the bladder as the bladder is shrinking when you remove the urine. It also is the place where any sediment, crystals, or stones will naturally pool. I'm going to go in, 45-degree angle. I'm going to aspirate and get my urine sample. Note that I am not moving my syringe or needle. I want to get 5 to 6 mils if possible. I am going to release the bladder and then remove my needle. I will now get my new sterile needle for transferring to my red top tube. So I have a new sterile needle. I'm going to put that into my red top tube. The reason we want to ensure that it stays sterile is because it is from a cystocentesis and we may need to send this urine sample to the lab for a culture. So we want to prevent any bacterial contamination. I want to label my red top tube accordingly. So patient's full name, their full signalment, the date it was collected, and the time it was collected. Once I've done that, I will fill out my requisition form with any tests that are needed. You also want to include on the rec form the time it was collected and the method that it was collected. It will be very important when the pathologist is reviewing it and giving us the results. After that, we will place the requisition form, the urine sample in a Ziploc bag, and place it into the fridge until it is ready for pickup to go to the lab.